Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which just means a high-risk pregnancy doctor. And today on the podcast, I have a very special guest, Alayna Ford. Alayna, welcome.
Thank you so much for having me.
Yeah, thanks for being here.
So I have kind of like a postpartum situation that happened after my second and following the SPD. So following the SPD, I deliver, you know, I'm feeling much better. Like truly when I delivered, like those SPD symptoms pretty much did clear away. But there were just some minor things that, you know, I did need like physical therapy for. Anytime that I would kind of like shift my hips in an odd way, I would get kind of like that same twinge again. And I'd be like, oh, you know, be careful here. So I went to PT for that. And then around like the 6 to 8 week mark, I wanted to get an IUD. So I had scheduled an appointment with my provider to get the IUD put in. And they put it in. No questions there. Like they didn't say anything, or they honestly didn't do a pelvic exam at my 6 weeks appointment.
After your delivery?
Correct.
Okay.
They just said, you know, how are you doing? How are you feeling? And like, it was very just kind of like a check-in, like just person to person check-in. That's it. No exam. Nothing.
Okay.
And then at that time was when I told her I want to get the IUD put in. And she's like, oh yeah, we can schedule an appointment for that. So I think it was like 2 weeks later, I come in to get the, you know, IUD inserted. And the provider who inserted didn't have any like questions or anything like that. And, you know, she was just like, oh, you're going to feel a pinch and, you know, it'll be done. Here I am with an IUD and I started developing like just not good symptoms. I felt like this heaviness in my pelvic region. I just felt like I was sitting on something all the time. Like I felt like I could feel it in me.
Not to interrupt, but now I have questions. Did they do, a lot of times when IUDs are put in, they do an ultrasound before, during, or after? Have you come back and check the strings and look at it and stuff? Any of those things?
No.
They just put it in and they were like, have a nice day.
Yep.
Okie dokie.
They put it in, they said, have a good day. And that was it. And so I, you know, over time, right? So it's probably about, I've had it in for about maybe a month. And that's when I'm feeling all those, you know, symptoms. And I'm like, this just doesn't feel right. I don't feel good. I kept getting this like urge that I wanted to pull it out. Like, and I was like, this is bad. Yeah. I should not have that urge.
For anyone listening, or if they're watching, but probably listening, an IUD is an intrauterine device, and it's looks like a letter T, kind of. And then at the inferior part of the T, there's these strings that are out of the cervix, but in the vagina. And so you can check the strings. A provider can check the strings after an IUD is placed to make sure the IUD is in the right place. And also you can do an ultrasound before, during, after placement to make sure that it's in the right place, because you can perforate a uterus, or it cannot be in the right place. It can fall out. Like, things can happen. And anyway, that's kind of what an IUD is. Okay, go on. I just want to make sure in case someone's like, what is an IUD? So go on.
Of course. It's a month out. I'm having symptoms. I want to pull it out. It's not a good situation. So I make an appointment with the provider. The doctor that I had been seeing for my OB, you know, throughout my pregnancy had left the practice. So I saw someone new. They weren't the person that inserted it either. You know, she's like, okay, you want to take it out? And I was like, yeah, just please take it out. And she's like, yeah, no problem. We can do that. So she, you know, goes to take it out. And just before she, you know, starts, you know, extracting it, she's like, you have a prolapse. And I was like, huh? What? And I'm like this, you know, like you're looking up at the sky. So I'm like this, like, what do you mean?
You're literally in the most vulnerable position you can be in. And then someone's like, oh, by the way.
Yeah. And I was like, she goes, oh, no one told you that? And I said, no, I had no idea that I had a prolapse. And I said, what is that? Because I didn't know what that was.
Yeah.
What is that? So she explains to me, you know, what a prolapse is. And she identified that I had a cystocele and a rectocele. So a cystocele prolapse is the bladder distends into the vaginal canal, and then a rectocele is your rectum pushing into your vaginal canal. So it's kind of like
Both were trying to come out,
sandwiching.
and they should be on their own side. Stay on
Correct.
your own team.
That was
Also,
traumatic.
how is it that the person that put the IUD in didn't notice that at all? Just out of curiosity. They didn't mention a thing, huh? Isn't that weird?
Didn't mention a thing.
Because there's no, I don't want to say no way. It's very unlikely that just in that last month, it just occurred. You know what I mean? Like it probably could have been there before. Okay. Well, snap. So did they take it out?
Yep.
Okay.
So she's like, do you still want it out? She's like, because I think this is what's contributing to your symptoms. And I said, I just want it out. After she pulls it out, she's like, can I look again? Like, you know, I hadn't sat up yet. So I was,
Sure.
you know, she was taking it out and I was still in the stirrups and everything. And she's like, do you mind if I look at the, you know, your prolapse again? And I was like, yeah, you know, so she looks again and then she's like in there and she's looking and then she pops her head up and she goes, how old are you? And I was like,
You're like, thank you so much, doctor.
thank you. This feels great. So I'm like laying in the stirrups again in the most vulnerable state that I could be in. And I just have tears streaming down my face.
Yeah.
Because it was traumatic.
Yeah,
It was just
for
like,
sure.
when I talk about it, it puts me back there. So
Oh,
I'm sorry.
yeah. That's fine.
But so yeah, she hands me a tissue and she's just like, okay, well, I'm going to send you to like a urogynecologist who specializes in, you know, surgery and prolapse repair, and to go get evaluated. So, I go and see him. He was like the type of doctor that we were talking about before, very like straight edge, you know, not very personable.
Cut and dry, very cut and dry.
Yeah.
Was there any discussion before you going to a urogynecologist of interventions or exercises or anything, or did they feel that it was already to the point where surgery was the most likely need for you? Or did they say?
They didn't say anything.
They didn't say anything. Well, see, that's annoying too.
So she just literally like wrote down his number on like a business card. And the more that I talk about this, it's like, where was I being seen at for my obstetrics? I'm not going to say.
No, yeah, but that's frustrating, right?
But it's frustrating because I just feel like from the beginning to the end, and I haven't gone back there again.
Yeah.
Just, you know, from this whole experience. So I go see the urogynecologist. He says I have a stage 3 prolapse, both of them. Both cystocele and rectocele is stage 3. He, you know, created this whole kind of diagram of like the stages of like what stage you're at and like, you know, a good pictorial of, you know, what was going on. And then he was talking about, you know, how it's, you know, something that can be corrected, that he can fix it, you know, surgically and all those types of things. And at that time, I was just so overwhelmed. I was a new mom. Like I just had a baby. I had this like traumatic experience with like the SPD, and I was just trying to feel better at this point, that I was like, surgery is not right for me right now. Like I appreciate the knowledge and the information.
Yeah.
But I'm not interested in surgery.
I get that there's a surgical field, but no one ever mentioned like, hey, yes, surgery is an option, but there's some other things. Like, did you have to push to get someone to give you other info?
Well, once I told him that I wasn't interested in surgery, then he was like, okay, well, we have pelvic floor therapy that we offer here in the office.
That should come at the beginning. Like your options include A, B, C, and D, and not just like your option is D. And not even giving you the option to decline D, but then when you're smart enough and like informed enough where you're like, I don't want option D. Oh, well, here's A, B, and C. You know what I mean? Like,
that's basically what they did.
Okay, that's just not cool.
Yep. So it just didn't feel like the right time.
Yeah.
Again, all the emotions, all the hormones, like everything that's going on, you just feel, I personally, I just felt like that was just too much on my plate at
Sure.
that moment. So he's like, yeah, you can come in and you can do pelvic floor therapy. This is what we can do. There's like a biofeedback type of machine that, like, you know, every time that you do a Kegel or you squeeze, it will like kind of dial those and like tell you how strong or weak they were. I didn't necessarily, the more that I went to that surgeon and his office, the more I felt like I wasn't really going and like really getting any more knowledge. You know, I just felt like I was going, they were hooking up the biofeedback machine to me and they were just saying squeeze.
Yeah.
And I just felt like I wasn't given more information, more like techniques, exercises. Like the exercises that she gave me were, you know, very, again, just kind of cut and dry.
Yeah.
She printed a pamphlet and she's like, do these every night.
This is their job. Like their little niche. Like this is their little thing, right? Like,
Again, just wasn't happy with that whole situation. And I went like 2 years after, kind of just like dealing with symptoms. And, you know, I was having pains and, you know, sometimes I'd have this like kind of burning sensation. And like, there were just lots of things that, you know, I was just trying to manage myself until I was like, you know, I feel like it's time for me to see a surgeon again. So I found another surgeon and I talked to him. I told him the situation and, you know, again, he was, you know, talking about that it's fixable, what he would do to fix it, you know, surgically. And
did you have any improvement over the time of doing the physical therapy?
So at that point, I didn't have any physical therapy.
Okay.
Really. I went to probably like maybe 4 appointments. And then I was like, I don't like what's happening. And I'm just leaving because I just felt like I wasn't progressing. And I was busy. Like, you've got a newborn, you've got stuff going on. So it's kind of like, you know, I kind of took a step back in like, you know, pushing harder to find a physical therapist after that. So like I said, I probably went about 2 years and I was like, okay, let me see a surgeon again and just, you know, I want to see somebody new.
Start again. Yes,
Start again. See. I spoke to him and again, I just kind of felt like it wasn't the right fit. And I, you know, and I feel like that matters so much. Like I feel like I have to have like a connection with that person when I meet them. And like, if I'm expecting them to like correct something as serious as I feel a surgery is, like I need to feel comfortable. And I didn't with that provider either, but he fortunately got me on physical therapy. So he wrote a referral for physical therapy and I was going for about a year consistently, which was really good.
And like a better regimen, I guess, to where they were more like you have metrics and you know what's like if you are improving and kind of checking in more. Yeah.
Yes.
Okay.
So
I like that.
I met, her name's Alayna. She was amazing, like night and day from what I had experienced before to, you know, her. It was just like such an improvement. And, you know, she gave me so much information that like I just love to soak that in. So like I love information. So the more that people share with me, I just love to know. So she was just giving me all kinds of good facts and things that I should look out for. And later on, like toward the end of the year, I was, you know, exercising more. So I was able to, you know, ask her some more of those questions. Like, you know, I'm really afraid to exercise.
Yeah.
Like, I just feel like I have this defect and, you know, I know that I have to be careful with what I'm doing and it's kind of scaring me to jump or anything like that. You know?
My friend the other day who has had 2 kids told me, she goes, is it normal that when I do jumping jacks, I feel like everything's going to fall out down there? And I was like, I mean, normal, no. But I mean, you've had a few kids, so maybe you should ask your doctor about that, though, and see if you can get. And I was actually saying physical therapy of the pelvic region is a legit thing. And I don't think people know it exists, number one. And providers sometimes don't even know it exists to tell their patients. And I will include links for that too. And you can tell me the local one that you had around here if you really liked them, but I've met quite a few of them and there's some online that I have kind of come in contact with that are doing some good things for like education around that space.
Yes.
Because It'd be great to start some of those things before we have babies,
Yes.
as patients, right? Or before you get to the point to where you almost feel like, or someone says to you, surgery is a good option. Like if you could, I don't want to say remedy it, but work on it before it becomes that much of a problem, right?
Yeah.
If we knew more about it.
And I was just going to say that. I just feel like I wish that when it comes to like understanding your body of, if no matter if you're a man or a woman, like understanding your body is important. But like as a woman, you know, we are so complex. There's so many complexities with us. And, having a baby and like growing a baby is extremely complex. Like down to the chromosomes, down to everything. It's just it's a miracle. Like it's truly beautiful. And I feel like I wish it was expressed and declared and spoken more of how important it is to like take vitamins before you want to get pregnant. Something simple as that, even down to like, okay, you want to have a baby, like you need to prep your pelvic floor.
Yes.
Like, what does that mean? And, it's like everybody just kind of takes it for granted that like I'm a woman and I can get pregnant and I can deliver a baby. And it's way more complex than that. I definitely feel like my prolapse and, how I came to learn about it and all of that stuff was really just kind of thrown at me. And I did not have any kind of preparedness or, not even my OB when I was pregnant had mentioned anything about pelvic floor exercises or therapy or like even talked about, just general strength that you need to be able to deliver a baby. And, again, I feel like it's taken for granted. And I really wish that people were, we could get that word out and it's more knowledge that like, hey, prolapses happen and they're real and it can happen to anybody. Like it's not just your grandma that needs a bladder sling. It's like you have had a traumatic delivery or, there's so many different reasons why somebody could be young. I was 22 when I had my prolapse, like when they told me about my prolapse. So
that's very young, and like everyone's different. And everyone's tissue is different. Everyone's pelvic size is different and birth stories are different. Right. And like you said, if you would have known a little bit more ahead of time, that would have been great. I do feel like everyone in general loves to focus on the growing bump and the belly and all the stuff leading up to the delivery. And there's not a lot of focus on that postpartum period. All of it, in all honesty, I always tell people it's this hugely vulnerable period. And in fact, when the baby delivers in the delivery room, I just remember this and it always broke my heart. Everyone goes to the baby. They leave this mother who's just done this amazing feat and delivered this baby, and they just leave her, right? And I'm like, still here, still like there's still a placenta that's got to come out. There's a repair that's got to be done. Like, we have to still focus on these patients, and the postpartum time is so important. Not for those reasons too, right? Yeah. All the reasons, and no one talks about the postpartum that much. And that's the part where moms are dying. That's the part where the lifelong complications of everything are there.
Oh yeah.
I'm working on getting involved with, it's called Postpartum Support International. And it's like this international postpartum group.
That's amazing.
Right. And so I didn't even know it existed. And I'm like, if I don't know it exists as being an OB and an MFM, how do patients know it exists?
They don't.
So then right. And so then how are the resources going to get out there? So this is the perfect topic. There's unfortunately so many postpartum topics, but this is one that I don't talk to many people about, probably because no one wants to talk about it. Not that it hasn't happened, but I think that it's one of those things that we've got to get more comfortable talking about those vulnerable spaces, because otherwise no one else is going to be comfortable talking about it.
Absolutely.
Yeah. So, yeah. And is it better now? How are things going with it?
Yes.
Yeah.
Following my PT, I was able to like reduce a lot of the symptoms that I was having, like kind of urgency and like those types of things. But there is just one area that no matter what, you kind of just can't, get back. And for me, I lost quite a bit of sensitivity.
Yeah.
So the only way to get that sensitivity back, like, during intimacy, is really surgery.
Yeah.
I've been managing that, and it's not all about that, right?
Yeah, yeah.
And it's all about like the connection you have with that person, and
Yeah.
and which is extremely deep. Like we're just like this. Like I can't explain it better. Like I met the perfect person. And he's been so supportive throughout all of this. Like
Yeah.
I just can't thank him enough.
I think that the connection is so huge because y'all had a kid together,
Yeah.
which is like the coolest thing.
Isn't it?
Yeah.
And it's so cool, and you can like see you and see them in them.
Yeah.
And it's like, oh my gosh, like you're having a daddy day. Like you look like
Yeah.
daddy more today, or like you look like mommy today. And
Yep.
it's just so fun to like see this little like human that you made, and like they act like you. They have characteristics like you, and they look like you.
Yeah.
It's really cool.
Those genetics, man.
Isn't it neat?
I know. They'll
I
get
always
you
think
far.
it's so fascinating.
Yeah. I love all this. Like,
Yes.
thank you for all of this information because it's a space, the postpartum and all the things that come after. Again, all that focus on the delivery sometimes and the ultrasounds and all the visits, and then the forgotten portion sometimes about after.
It's absolutely a forgotten portion.
Yeah. I'm glad you found a doctor that you liked better, that was helpful and got you referred to someone that you needed, which is, I think, a huge thing too.
Oh, absolutely.
So
if it wasn't for his referral, I
Yeah.
don't know where I would be at this point.
Yeah.
But I actually do have some kind of big news. So I met with another urogynecologist, and I'm actually really considering surgery now. He has quite a bit of like success stories, and a lot of people did kind of like a testimonial
yeah.
on like surgeries that he's done, and like all of the things. So I actually met with him twice now, and I have a way better feeling and like impression, and just general sense of like he cares.
Yeah.
So I feel like I'm gonna move forward with getting a surgery.
Nice.
Yeah. So the date is set.
Fantastic. Congratulations.
Thank
and
you.
that's really good. Like, because it's been years since the original diagnosis, it gave you time to understand everything, to get your body more prepared as best you can.
Yeah.
And to have a surgeon that you're comfortable with. And
I needed all those things.
yeah.
Yep.
And that's perfect. So don't ever let anyone push you into surgery, whatever it's for. No, because you'll never, and complications can happen with any surgery. But I tell you, if a complication happens with the surgery and you didn't like the doctor as a person versus a complication happens and you like him as a person, the risk is going to be there for any surgery, right?
Absolutely.
It just goes, it's more tolerable. And it's like, well, I know that they were doing the best they could. And sometimes things happen, right? But yeah, I'm so excited for you.
Thank you.
This is great.
I just feel like from all of this, I feel much more confident. I feel much more confident with myself. I feel much more confident with my body. I feel much more confident in, again, advocating for like what I need and what I want.
Yeah.
And I just feel like everything needed to happen at its right time.
Yeah.
And I feel like I'm on that track.
I love that.
Yeah.
Yay. And you have 2 beautiful children.
I do. Two beautiful boys.
And y'all only had boys. That's right.
Yep. Just 2
Okay.
boys.
Well, lovely. Thank you for sharing your stories today. I'll put links below for physical therapists and information on the pubic symphysis separation. Well, we're going to keep being curious and keep trying to expand our knowledge and really work on learning things surrounding this pregnancy space, develop some skills, just like you were saying, really being prepared. And I'll do my best to keep preparing you guys and having an impact, not only on you guys today, but on anybody listening and on people that are looking for future pregnancies or who have been through one and going through that postpartum period. We're here to support you with that. So thank you so much for listening. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.